Come in.
Hi, I'm Ninya and I'm going to be your nurse today, in which today we're going to be performing a cardiac and respiratory assessment. But before I get started, I'm going to go ahead and pull this curtain shut to provide privacy and then wash my hands as well.
Okay.
Alrighty, may I have a look at your wristband? And can you please state your first and last name for me?
David King,
And your date of birth, sir?
December 9th, 2010.
Okay, thank you. Alright, as I said, we were doing a cardiac respiratory assessment. Before we get started, is there any questions or concerns, any risk factors, anything I should be aware of?
No, ma'am.
Okay, so while I was asking those questions, I was also making note of your consciousness to be everything was fine. You answered every question as expected. Then I also was making an assessment of your skin color, which is not pale. Skin color is as expected for your ethnicity. And then also I was assessing your the rise of your chest just to make sure that you wasn't in any type of respiratory distress, no use of your accessory muscles or your nasal flare. Now with our assessment today, there will be inspection, just overall looking, and then also palpitation, meaning that I would have to touch you at some time. Is that okay with you?
Yes, ma'am.
Okay, so I'll go ahead and get started. Let me go ahead and I'm gonna feel your thorax and around your rib cage just to assess your lung inspection. Can you go ahead and take a deep breath for me? Can you sit up straight and do that again for me? Sit up straight. Okay. Just breathe normal, sir. Tickle you, sir? Okay, I'm sorry. I'm not trying to tickle you. I'm sorry. To get just to make sure that everything is fine, can I please ask that you breathe again, just as normal? Alrighty, that seems to be normal and equal. Go ahead and turn so I can go ahead and check your back. Now, when I place my hands on your back, I want you to say 99 each time you feel me moving down, okay? That's what we call tactile firmness. I'm just checking your the vibration, okay? So every time I move down, you say 99, okay? Alrighty, let's go ahead. Go ahead.
99, 99, 99, 99.
Alrighty, thank you. You can go ahead and turn back around for me. And then also now I'm gonna go ahead and listen to your 8 lung fields also on your front, your anterior and also your posterior, just to listen to your lungs to make sure everything is clear there. I'll go ahead and start be 8 places from side to side, okay? Now you can just breathe normal. Normal, sir. Okay, turn around for me for your back. Alrighty, go ahead and turn back around for me. So that seemed to be clear. I didn't hear anything that was concerned. Did you have any discomfort during that?
A little bit.
Okay, so what area did you have discomfort, sir?
My rib cage.
Alrighty, let me relook at that. Go ahead and turn back around. Was it during the 99 or when I just had you breathe?
Have me breathe.
Okay, go ahead. Go ahead, breathe. Yeah. Okay, already turn back around. Let me go ahead and check for your side to side. Okay, so I don't hear anything That sounds abnormal to me, and a lot of times when you're having pain, it could be for strain to your muscle if you were doing something physically recently. So that's something we'll definitely notate as well, okay? Now I'm gonna go ahead and listen or check your carotid arteries, okay? Okay, that seems to be fine. Doesn't seem to be any thrusting or any unnecessary palpitation. Let me go ahead and listen. Okay, I don't hear any worries, just like a rushing. That's normal as well, okay? And now I'm gonna go ahead and listen to your heart. But before I do so, I do wanna go ahead and check the areas that we're gonna be listening to just to make sure there's no tenderness or anything. Anything there? Okay, I'm gonna go ahead and listen to your heart. I'm gonna ask that you lift your shirt up for me, sir. Alrighty, we wanna make sure that we're getting a clear sound with no friction from your clothing. And you lift your shirt up for me. Alrighty, thank you. Okay. Alrighty. So everything sounded well. That concludes our assessment here. I'm gonna go ahead and wash my hands. Pull the curtain back, and then make sure that you have your water accessible and also your nurse call light. Do you have any questions before I leave?
No, ma'am.
Alrighty, well thank you, Mr. King, for your time. I'll check on you in a little bit.